I've been in this field since now 25 years, practicing obstetric gynecology with a lot of focus on infertility and, of course, advanced fertility treatment. India has a huge problem of infertility. Worldwide, we see about 10% of married couples facing some level of infertility, that is, inability to conceive after 1 year of trying. Many of these problems can be solved at a basic level. Simple medical therapy, simple interventions will help the couple achieve pregnancy. But with the increasing number of problems such as hormonal imbalances, maybe because of stress, environmental toxins, lifestyle, we have many problems such as polycystic ovarian syndrome. We have in India specifically huge problems such as tuberculosis, which is a disease which really brings about massive damage to the woman's pelvis, genital organs, etc. And so with diseases such as these, with problems like endometriosis, fibroids, so there's a lot of pathology. On top of that, today, India also is having a lot of working women, professionals. They're delaying marriage, they're delaying childbearing. Men also are undergoing a lot of stress, smoking, alcohol, and influence of the pesticides and such other things which is bringing down sperm counts. So from all fronts, we seem to be facing a lot of insults which are adding to the burden of infertility. And so the numbers of the patients coming to specialists for infertility treatment is really increasing by days every single day. Just like I said right now, the number of patients seeking fertility treatments is pretty large. Seeing the demand, there are a lot of centers offering fertility treatments across the country. Some of them, of course, are good, standard, high-level centers. Some of them are really small, almost you may want to call it fly-by-night operators, who are really not having adequate infrastructure, who within an existing nursing home are setting up a small corner for offering fertility treatments. There may not be enough expertise, there may not be enough workforce or personnel, as well as not enough equipment and training. And as a result, they are offering, in certain situations, suboptimal treatment. One of the reasons for this, obviously, may be the lack of funds, because obviously setting up a state-of-the-art infertility or IVF center requires good amount of funding. And so many of the centers across India, unfortunately, are not standardized, are not up to the mark as far as infrastructure and provision of adequate care goes. And so there is a huge need for standardization, for good reporting, for good infrastructure, for funding to enable all of them not only to set up a good center, but also to provide training at every level, so that across the country there is reasonable level of advanced infertility care given to all the patients. So infertility and advanced fertility treatments, the numbers are only increasing. As the awareness increases because of media, there is more and more sort of buzz in the market about this. And earlier it was something which patients were also very skeptical about, or they were little, not open about it, they were not vocal about it. There was some kind of a stigma attached to fertility treatments. Fortunately, this is going away. And as the stigma disappears, people talk about it more openly. Celebrities are talking about it, the use of advanced fertility treatments to further their reproductive careers. And so as it comes out in the open, more and more people are accepting of it. They're coming into the area and seeking treatments. And so the requirement of good centers providing these services is only going to increase. And so India is a huge market. We do have a number of IVF centers, but like I said, many of them are really not up to the standard. And with time, the market is going to really, really increase as our patients are able to afford more treatments, as they're more aware of the availability of such treatments. As the stigma goes away, more and more people will come in seeking advanced fertility treatments. I think one of the most important things probably is standardization, which unfortunately does not exist in this field. Also because we don't have a very proper law on assisted reproduction, and there is no reporting. We do, as the body, as the governing body, the Indian Society for Assisted Reproduction, do bring out a registry every couple of years. But as the reporting is voluntary, not many people offer their data. So we are not very well informed about the kind of services available, what kind of results are being offered by every center. So the top of the line centers are equivalent on par with the centers all across the world. So I think we have equal results as a good center in the US or UK will have. But I'm not sure I can say that about every single center in India. And so it's important to really standardize, to have good data coming in, to have good reporting coming in, and to sort of have more transparency and more sort of availability of standardized centers across India. I already mentioned that media plays a huge role on both sides of the spectrum for the patients to get this whole information, real knowledge, not some random headlines which are really misleading, actual scientific knowledge for the public. And so various aspects, whether it's print media, television, internet, it's all contributing towards increasing awareness and genuine knowledge for the person who's seeking fertility treatment. And on the other side of the spectrum, involving the doctors, improving their knowledge and information, helping them maybe connect with people who may be able to supply them with some good support in terms of infrastructure or capital investments. And so I think initiatives like this really work across the spectrum from patient to doctor to clinics to hospitals, and helps improve. At the end of the day, all of us are working towards providing fantastic healthcare for our patients and making sure the patients get the best possible facilities that we can offer them. So I think initiatives such as these really work towards that one common end, that the patient really benefits at the end of the day.